Hi guys, Dr. H here, your source of musculoskeletal care, and welcome to part 3 of this 4-part series looking at the myriad health benefits of resistance training. So in the first video we looked at how strength training or resistance training can improve all-cause mortality and morbidity. In other words, it decreases your risk of death and it decreases your risk of serious illness. In the second video we dove a little bit into why that might be. Muscle sort of functioning like almost an endocrine organ, affecting your metabolism, your immune system, all that great stuff. But in this video, we're going to talk about how muscle is the great protector. And in many ways, I think this function is almost even more important than staving off death and disease. How? Well, let's talk about that. So in my mind, strength training does something better than just helping you avoid illness and stay alive, but it helps you live, right? So muscles are a big part of how we move and how we interact with our environment. And these things can break down. Injury can happen. And as great as it is to be able to fix these kind of injuries, it's sometimes better to be able to just prevent them altogether. And muscle and strength training plays a very important role in that. And these are what I call sort of its functional benefits. Again, the last video was all about sort of its metabolic benefits, its immune benefits, things you can't really see or experience per se. These are more the functional benefits that kind of affect just everyday life. So the irony is that some people are afraid to start a resistance or strength training program because they're afraid of getting injured. But the research shows really quite the opposite. In fact, there's a dose-dependent relationship between how much strength training you do and your risk of sports injury, like the study here showed. What that means is the more strength training or the more resistance training you do, the lower your chance of a sports injury. And even if you don't play sports, this is the kind of injury you might get because you trip and sprain your ankle, or you're trying to lift boxes and you pull something in your back. Injuries that are kind of a one-time occurrence because of an activity you were doing. But maybe even more importantly, sort of an offshoot of this study looked at strength training and its effect on what we call overuse injuries. So these are not injuries that happen because of a one-time thing. These are injuries that happen because of a long period of time of bad habits, things like poor posture or things you might have to do for work or for your job that require you to do repetitive motions that eventually build up and lead to injury. The fact of the matter is probably the majority of the patients in my clinic are coming for injuries that are what we'd call overuse injuries, as opposed to, I pulled something, chasing after my kids in the backyard. It's more of, I've been sitting for years and years and years at a desk and now I have back pain. So I've already talked about one of the best ways to protect against overuse injuries in a video up here, something I call proprioceptive retraining. But this study showed that strength training halved the risk of overuse injuries in the people who were studied. And that's pretty significant because, again, sometimes we can't avoid the things we have to do for work or the things that we have to do on an everyday basis. And our bodies are surprisingly not understanding about that. Over time, even if you have to do a certain activity, you may risk injury because of how much you're having to do that activity. Well, one way to kind of offset that risk, at least according to the research, is, strength training. But strength training isn't just good for your soft tissues like your muscles and your ligaments and preventing strains and sprains. It's also really, really good for your bones. So as this meta-analysis shows here, resistance training prevented and even helped reverse osteoporosis, which is when your bones become too weak and you have an increased risk of fracture. And this has been confirmed in multiple studies. So here's just another one that compared against strength training versus aerobic training and found that strength training was unique in its ability to help prevent and reverse osteoporosis. So it seems a little intuitive because bones have this attribute where they will increase their strength if you put more load on them. And so the idea is if you're doing things like weight training, you're putting more load on your bones and therefore you're going to make them stronger. Or if you increase your muscle mass, you have heavier tissue kind of sitting on those bones, it's going to make them stronger. And that is true. That is absolutely 100% true. But again, it's not the whole picture. So to understand the whole picture, we have to return once more to myokines, those chemicals that can be released by your muscles when they contract and are released more obviously than when you're exercising. Well, this study here did a deep dive into how myokines affect bone metabolism. So you essentially are always trying to reach this homeostasis in bone growth. You have cells that break down bone and you have cells that lay new bone. Osteoporosis essentially is you have too many cells breaking down bone and you don't have enough laying down of new bone. And what this research really looks at is how myokines influence this bone building and bone destruction activity to try to balance it out and maintain healthy, strong bones. And it's not just elements of your musculoskeletal system that strength training protects. This study here, for example, looked at young men, and they found that strength was inversely related to aortic stiffness. In other words, the stronger they were, the less stiffness their arteries had. And this is important because arteries need to be able to expand to accommodate different pressure changes, for example, in your blood pressure. And if they're not able to do this, they risk injury. And so we don't want stiff arteries. That's a bad thing. So the implication that being stronger may actually lead to decreased stiffness in your vascular system shows that strength training might be protective against a lot of different cardiovascular diseases we worry about when arteries get too stiff. Now, just like we talked about some of the more newer, younger research in the last video, we'll talk about some of the newer research that's coming out now, specifically on how strength training and resistance training can help heal the heart, so to speak. Now, if you're going to study an injured heart, you usually have to do that in a controlled way. In other words, you have to induce that injury. It's not terribly ethical to do that to people. So a lot of this research is being done on mice and rats, where they're using medications to induce heart injury. In the case of this study here, a common chemotherapeutic agent called doxorubicin. Doxorubicin is known for being cardiotoxic. It damages the heart. But what this study showed is that resistance training improved cardiac function after they damaged the hearts with doxorubicin. It can help offset the cardiotoxic effects of this chemotherapeutic drug. This implies then that strength training has potential benefits for heart health even if the heart has already been injured. Another similar study was done in rats, where they gave the poor rats diabetes. They do this a lot. There's a lot of diabetic rats out there. But they looked at how resistance training improved hearts that were damaged from diabetes, and they showed it improved things like systolic function, which is how much blood and how efficiently your heart is able to pump blood to the rest of your body. And it also showed that resistance training was able to help reduce the impact that the diabetes in these rats had on what we call the autonomic function of the heart, which is sort of your parasympathetic and sympathetic system's ability to control things like heart rate and how hard your heart contracts. And continuing looking at sort of autonomic function, they've done some studies that, again, are very much in their infancy, but they've done them actually on humans. They've looked at healthy humans and found that resistance training improves their tolerance of what we call a tilt table test. And this is sometimes a test we use to study the metric of how well your autonomic nervous system is functioning. Well, the research has shown that strength training really helps improve the tolerance for this test, and this kind of implies that it helps improve the function of the autonomic nervous system. Now, again, that's not a statement we can make too definitively yet. This research is still very young, but it's something to keep looking out for because autonomic dysfunction is becoming a more and more prevalent thing. But it's not just the autonomic system of your nervous system that strength training can help, but it can help the brain function as well. So this study here looked at strength training compared to endurance training in older adults to see what effect these different exercises had on cognitive function. And what they found is that resistance training had dramatic benefits for cognitive function, particularly with sensory processing. In other words, your ability to sort of take in sensory stimulations from your environment and process that in your brain, which unfortunately is something we tend to lose as we age and as our brain ages. But it's not just cognitive function per se, but also your overall psyche, your overall mood. And what they found with strength training is a reduction of things like anxiety, in pain intensity in people who had what we call centralized pain syndromes, things like fibromyalgia or chronic pain syndromes. It improves overall cognition in older adults. It improves sleep quality. It reduces depression. It improves your self-esteem and gives you a greater sense of well-being. So overall, strength training can help your brain work better, it can improve your mood, and it can decrease chronic pain. Again, harkening back to that centralized pain syndrome, this study here looked at resistance training in patients who had fibromyalgia. One of the things they were looking at is resistance training even a feasible treatment option for these patients because, well, they are awfully sensitive to pain, and that can sometimes be an issue with resistance training. And what they found was not only was strength training a feasible type of treatment for these patients, but it improved their overall functional capacity, meaning that not only did they feel less of their chronic pain, but they felt like they were able to do things better without that pain. And that's a serious thing for people who are suffering from chronic pain conditions and may feel like they're losing a lot of function or mobility because of that condition. Another group that suffers a lot of chronic pain issues and functional deficits are patients who are too mobile, or what we call hypermobility syndrome. And what they've shown is that some of the best treatments for people with hypermobility are regaining proprioception, which is your ability of knowing where you are in space. I've got a whole video on that here. And strength training. Now again, it may seem counterintuitive to do something like strength training in people who have unstable joints, but so long as you followed a few guidelines, which is the topic of the next video, it was very safe and, more importantly, very effective. You're essentially trying to train the muscles to do what the joint ligaments can't, which is provide stability and provide awareness of where things are in space. And then another cohort I always like to talk about is patients who suffer from osteoarthritis. I see a lot of patients with osteoarthritis, and most of them are very resistant to the idea of doing something like strength training. At some point in time, they were told that things like lifting weights or working your muscles was hard on your joints. But research shows this could not be further from the truth. So for example, this study here showed that exercises to strengthen the muscles in the legs, in this case particularly your quadriceps and hamstrings, had no adverse effect on knee cartilage volume and thickness. And in fact, other studies have shown, like this one here, that it may have even a protective or beneficial effect on the cartilage in your joints, which probably explains why studies like this one show that resistance training is incredibly beneficial for people who have osteoarthritis. In fact, it's one of the major contributors to improving functional capacity and decreasing pain. So in this video, we've shown you how resistance training can really help improve and protect your soft tissue, your bones, your nervous system, your cognitive function, your mood, all of it. So other than doing things like having good nutrition and having good sleep hygiene, resistance training is probably one of the best things you can do for your overall health. We've shown how it improves everything from metabolic issues, inflammation, decreases risk of cancer, can protect from injuries, improve bone density, all that great stuff. So I'm hoping that these last 3 videos have really convinced you to start or perhaps restart a resistance training program. What the next video and the final video is going to be about is how to do that. I'm going to provide some simple guidelines on how to get started with a resistance training program so that you're doing it in a way that's safe, effective, and will give you all these great benefits that we've talked about in these previous 3 videos. So until that video, keep moving.